It is just vein until it's not. Most people hear the same thing. It's just varicose vein. But what starts on the surface often becomes a progressive medical disease. And the reason it keeps getting missed is because we misunderstand what actually is failing. So to see that, we need to start with what superficial venous disease really is. It means the veins near the skin, so at the surface, can no longer move blood efficiently back to the heart. Blood pools instead of flowing upward. This is not cosmetic failure, it's mechanical failure. And once mechanics fails, pressure takes over. What is the one-way system means? Healthy veins depend on one-way valves. Muscle contraction control the pressure. Blood goes up, valves close, pressure stays low. But when valves weaken, the entire system reverses gravity. So how valve failure increase pressure? When valves fail, blood falls backwards. Pressure builds. Vein stretches and enlarges. That pressure does not stay local, it spreads through the superficial system. And this explains well why symptoms don't stay small. So how this shows up over time? I see this progression consistently. Early, heaviness, aching at the day's end, ankle swelling. Then after it would be bulging veins, skin darkening, inflammation, and at the later stage we see skin breakdown, venous ulcer. This did not happen suddenly, it progressed quietly. And this is where people are often given false reassurance. So remember this. Symptoms control does not mean disease control. So compression helps symptoms. It does not fix valve failure. So once the stocking becomes off, pressure returns, symptoms return, damage continue. So the key question here becomes, who should treat and when? Let me tell you who should never wait and see. Because not everyone with veins need treatment, but you should not wait if you have this. Daily symptoms, skin discoloration, swelling that does not resolve, prior clots, family history of ulcer. Appearance alone is it not the issue. Pressure and symptoms are. And there are some certain factors, we call them accelerating this disease. So they don't induce it, those are accelerators, not causes. These don't cause, as we said, the venous disease, they just accelerate it. Pregnancy, prolonged standing, obesity, prior DVT, genetic. Pressure plus time equal progression. Very important to remember. So, proper diagnosis matters, but how do we make the right diagnosis? the test is ultrasound, not guesswork. Correct diagnosis require duplex ultrasound, will give us the valve function testing, reflex mapping. Looking at the vein without ultrasound is like judging heart disease with only an EKG. And once you identify the failed valve, treatment becomes logical. So let's talk about the modern treatment. The modern treatment is to fix the pressure, not the skin. And the modern treatment focus on closing valves, failed veins, redirecting blood flow, lowering venous pressure. This is not cosmetic removal, it's a pressure correction. And when pressure is corrected, healing follows. This is the line I think our patients should always remember. Superficial venous disease is a pressure disease masquerading as a skin problem. It is common, it is progressive, and it's treatable, but only if it's recognized early. Very, very important. I'm Dr. drbenmaamer. If you believe healthcare in America needs to change, hit follow.